platform. I'm going to talk fast. There's a lot of information, and I tried to cut out some slides from my normal sort of hour-long talk, and I struggled to do that. So I may not go quite into as much depth as some of the information on the slides, but I do want to try to at least touch on a number of different topics because there's just so many really important issues that our patients and ourselves will be facing. So I'm going to go over today a little bit about what I like to call the chief complaint, which are some of the problems with our current system, and then get a little bit into the policy versus the politics of what's happening around us. And if we have enough time, talk a little bit about the role of students and physicians and nurses and all sorts of different healthcare professionals in this effort as advocates. So as I'm sure many of you know, we have some pretty significant problems in our current U.S. healthcare system. We have around 47 million people uninsured. That represents about 15% of the population, and 81% of those people are in working families. So this isn't the true poor. Most of those individuals are able to qualify for Medicaid. Most of these are pretty hard-working middle-class folks that just can't get access to insurance for a variety of reasons. One of those reasons is that employer-sponsored insurance rates are falling. So in the year 2000, 66% of non-elderly Americans, so people who are under 65, don't qualify for Medicare. 66% of those folks were covered through work in the year 2000. By 2009, that was down to 59%. And that's been for a whole host of reasons. Employers have been dropping insurance coverage because it's so expensive. And then added on top of that was our current economic situation, which has caused even more employers to find offering health insurance just too expensive. Another problem that our patients face is something called underinsurance. And what this means is that people have a health insurance policy and they think that they're covered, but then when they actually get sick and go to use it, they find out that, ooh boy, a whole bunch of things are not actually covered. One of the examples that we hear somewhat frequently are people who have these catastrophic plans. So maybe they need surgery because there's a suspicion of a tumor, let's say. And the policy covers that because that surgery, that event is considered somewhat emergent, kind of falls into that catastrophic category. But then that tumor is found to be cancer, something that's going to require months of treatment as an outpatient. And that's not considered catastrophic. That's not an emergency. And so those treatments may not be covered or be very poorly covered. So that's an example of being underinsured. And this number, the percentage of people that are whose bankruptcies are affected by this is controversial. People argue about it, but there is no doubt that a number of bankruptcies in this country are related to being underinsured. Now, from society's view, healthcare in the United States is way too expensive and is of insufficient quality. The United States leads the world in per capita spending on healthcare. So what that means is, if we do the math, in 2009, if you took the population of the United States and you divided it into healthcare spending, the United States spent about $8,047 per person in this country on healthcare. That's about 24% higher than the next highest spending country. So take any country you can think of, any of the European Union countries, and we are way above them on a per person spending. Now that might be okay if we've got really incredible results from that spending, but the problem is that we don't. People argue also about World Health Organization rankings, and we can argue that until we're all blue in the face, but the bottom line is we're nowhere near the top 10. We're not even anywhere close, no matter how you do these numbers, on any of these fairly important items. And this is a great article that was, let's see if I can get this little thing out of here, that was published online in August at the Urban Institute and the Robert Wood Johnson Foundation. And this was an article that, it's a really accessible, easy to read article compared to a lot of the stuff that compares quality. And they were really looking at the data out there about where the U.S. is in terms of being the best in the world. And here's what they found. This is just a short paragraph from the conclusion. The authors found that there's no hard evidence that identifies particular areas in which the United States healthcare quality is truly exceptional. Instead, the picture that emerges from the information available on technical quality and related aspects of health system performance is a mixed bag, with the United States doing relatively well in some areas, such as cancer care, and less well in others, such as mortality from conditions amenable to prevention and treatment. And this last part would be of no surprise to anyone who does any type of primary care or is interested in primary care. In fact, we spend very little on prevention or primary care in this country, and the current euphemism in Washington is that we actually have a sick care system, not a health care system. And what's meant by that is we don't really invest at all in keeping people healthy in the first place. We wait till they get sick, and then we spend lots of money trying to get them, restore them back to health. Now, many people feel in this country that it is way too expensive to deal with all this healthcare reform, and we really should just leave us at the status quo, or maybe tinker around the edges a little bit. But so I want to give you some information on what would happen if we did nothing. So in the year 2009, the U.S. spent $2.5 trillion on healthcare reform. So that's an important number to remember, $2.5 trillion. Because the cost of the current healthcare reform bill that all of this argument has been about for the past year is just under $1 trillion over 10 years. So in 1 year we spent $2.5 trillion, and that's been escalating every year. And the bill that we've been having all of this discussion about is just under $1 trillion over 10 years. So that puts into context that it's actually a pretty tiny fraction of our total healthcare spending. And that $2.5 trillion number is up 5.5% from 2008. And that's been about what we've been seeing for the last 6-8 years, about a 6% increase in healthcare spending year to year. This represents a little over 17% of the gross domestic product of the United States. And the portion of that is paid for by public sources like Medicare, Medicaid, Veterans Administration, etc., is up about 8.7% and is now at $1.2 trillion. And then private payer represents the rest, and you can see it's up only about 3%. Part of what's happening with this public payer growth is that in 2009, a tremendous number of people who lost their employer-based insurance, if they could qualify for Medicaid or Medicare, took advantage of those programs and shifted over to public sources of healthcare financing. And that's reflected in there was an actual decline in enrollment in private plans. And the expected growth continues for the next decade out, about 6% annually, which is 1.7 faster than the expected growth in the gross domestic product. And public payers will cover over 50% of healthcare purchased in 2012 because of this escalating growth. And that does not take into account that we don't pay income taxes on our healthcare benefits that those of us who do get it through our jobs get. And if you took into account that really tax-free benefit, the government is already paying for about 63% of healthcare in this country. What about on a personal level if we do nothing? Well, in 2008, the average family health insurance premium was $12,298. And at current rates of growth, if they just stay stable, by 2020, that same policy will cost $23,842. Accelerating in cost way more quickly than wages are actually accelerating. So it's not like we're going to be able to keep up. It's going to be relatively more expensive by 2020. So much so that it's estimated that the amount of uncompensated care, so people who don't have insurance, would double in 45 states by 2019 because people would simply not be able to afford health insurance. It doesn't take a whole lot to change this growth curve. If you could slow premium growth by even 1.5% or even 1% over this time, by 2020 that would translate into $2,500 of savings or almost $4,000 worth of savings if you were able to slow that growth by 1.5%. So how did we get to this crazy mess? Well, this country has this idea of individualism as its core. You know, this country was founded by many people who were fleeing oppressive governments, and they came here so they could do their own thing kind of pretty much unhindered. And that approach and that idea has been an underpinning of our current healthcare system, such as it is. And there's been a constant tension between the role of government in this system and the role of the individual or the marketplace in creating the healthcare system.